Hello everyone, Dr. Kimball here. We're going to continue our Spine 101 series, and today I'm going to be talking to you a little bit about what is your spine made of, and just a little bit more about what your spine, how it functions, some of the anatomical components, a little bit about the nervous structures and spinal cord and such. But I'm just going to start out with going through just some basic anatomy of the spine. So the neck we refer to as cervical, the midpoint in the spine, midsection, thoracic, and then the lower portion is the lumbar, okay? The cervical spine is made up of 7 cervical vertebrae. The top 2 have a much different anatomy than the numbers 3 through 7. The top vertebrae interacts with the base of the skull, and so that is called the atlas, and then there's one vertebrae underneath it, C2, and that's got a very odd structure. It's built for kind of handling the rotation of our spine. A lot of it happens at the C1-2 interface. And then most of the spine problems that you're going to see or have, where you have disc problems or facet problems or pain generators or nerve compression, generally happens somewhere between C3 and the thoracic spine, T1. So most common levels, I would say probably C5-6 and C6-7. That's the mid to lower section of the neck, and the discs can fail at those levels for a variety of reasons. Most of it has to do with that those levels are at the lower section of the cervical spine, and a lot of motion, kinetics, a lot of forces are at play there, and that's why they wear out sooner than later. Same thing happens in the lumbar spine. I'll get there in a minute. The thoracic spine is made up of 12 thoracic vertebrae, generally all similar in shape. This is a little model of a lumbar, but the thoracic ones look pretty similar. The one thing to note, and the key thing about the thoracic spine to know, is that there's a rib coming off at each section in the thoracic spine. And the rib is kind of an important structure related to the spine because it connects to our sternum in the front. Not every level connects to the sternum, but most of them do. And that adds a tremendous amount of stability to the thoracic spine. So patients will come in with thoracic type pain. It's very, very uncommon, not saying never, but it's uncommon to have a problem in the thoracic spine that would require surgery. The discs, because of the amount of support from the ribs and the sternum, tend to fail less often. They are also much less mobile than the vertebrae in the neck and the ones in the lumbar spine. So, traveling down the lower lumbar spine, this is a model of the lumbar spine. This is the sacrum. The lumbar spine ends articulating with the sacrum, so the L5 vertebrae and the S1 interact to make up the L5/S1 disc space. That's how we refer to every level in the spine. We refer to the top vertebrae and the bottom vertebrae, and then the disc in between. That's how it's classified. So the L5/S1 disc tends to have the most stress, tends to wear out most commonly. That makes a lot of sense, right? You also note that there's no ribs coming off of these vertebrae either. And so you have the whole weight of your upper body basically coming down on this last lower lumbar vertebrae and disc. Now the vertebrae tend not to fail. They're made of bone, just like the other bones in your body. There's a lot of bone marrow in the spine, in the vertebrae, but it's uncommon for the vertebrae to break unless you have trauma or some sort of bone density problem. So patients with osteopenia or osteoporosis, that can happen with aging, more common in females than in men, can develop spontaneous fractures to the vertebrae that can cause pain. We'll get into that and how you would treat that or manage that at another time. But aside from the bone breaking or degenerating, what typically happens is the disc will wear out. So there are 3 different ways to look at the spine. One is globally, and when I say that, I mean I'm talking about your whole posture, how you're standing, whether or not your head is in front of your pelvis or behind it. The second way would be regionally, so just talking about the neck or the thoracic or the lumbar region of the spine. And probably the the last and probably most common way to look at the spine is to refer to it in segments. So one segment of the spine, we'll use this model. This is one segment of the spine, one disc, two vertebrae unit. Now each segment of the spine has 3 joints. There's a facet joint on the right side, a facet joint on the left side, and then a disc space in the front. Now, I've already talked in some other videos about how the disc is the core and primary movement center for each segment of the spine. When the disc fails, then the facets tend to fail. It's uncommon for the facet to fail first. It can happen, but usually it's a secondary action that occurs after the disc fails. So when your spine starts to go through the aging and degenerative process, there can be a lot of changes that happen. That change is something that we refer to as ankylosis. It's a big medical term, sounds really complicated. Really what it is when this disc collapses, I'll show you a little video at another time, the vertebrae actually start to grow bone around the disc and they almost want to kiss together. So as you age, you might know that you're getting shorter and that you're losing mobility. Well, how am I losing motion if you still have vertebrae that aren't fused? Well, the disc collapses and then the body starts to develop bone spurs or ankylosis around these joints that they start to kind of limit the mobility present in those joints. Now, when your body grows that arthritis or that ankylosis, it restricts motion and it can also cause irritation of the disc and the bone and also the surrounding muscle and ligaments. It can even cause compression of the nerves or the spinal cord, which then would prompt you to come and see someone like me to ask what's going on.